better.
Very cool. Yeah, no, just we had some people request information on IC, and I feel like I've given that a few times already. And so I wanted a different perspective and have somebody else's eyes that are in the space and are dealing with other issues that arise secondary to that, and to give you to kind of talk about some of the things that you're doing for IC.
Yeah, absolutely. So oftentimes with IC, we get a lot of pelvic floor overactivity, or pelvic floor muscle overactivity, I should say, which to a lot of people looks a lot of different ways, but some common things that you would see is that overactive bladder because of it, or the pelvic pain there because of it. So pain with intercourse, or pain with urination, or just lower abdomen spasms from that. And I kind of think about it like, if the bladder is kind of mad, then the pelvic floor is trying to protect the bladder, and it thinks that it's helping us out by tightening up, when in reality it doesn't. And so that's oftentimes what can result from IC.
Yeah, and that's kind of what I tell people too. When you get all that inflammation in the bladder, I kind of use the analogy that if I take a knife and stab you in the arm and it hurts, and then I do this again, people retract.
For sure.
And the pelvic floor does that, is essentially, for those that don't know about IC or not really sure what we're talking about, what it is this chronic inflammatory condition of the bladder that leads to symptoms that are very similar to urinary tract infections or recurrent urinary tract infections, bladder pain, urgency, frequency, painful intercourse. And a majority of what happens, you get that inflammation in the bladder, and then that's then referred to the pelvic floor, which is just a hammock of muscles that help with your pelvic floor function. And so many times, if not all the time, when I see people who have IC, about 80% of them will have some form of pelvic floor dysfunction. And about, I think the number that I read was 70% will have one muscle involvement, and about 60% will have multiple muscle involvement. Do you see that?
All the time. Because then, our body is very 3D, and it's almost like a neighborhood. So if you kind of make one neighbor mad, typically you'll make a couple neighbors mad. And so then, you get your lower abdomen and your abs involved, your deep core involved, some hips. So I've seen a lot of it even hugging the side of dysfunction, where they've had like a hip history. So it can kind of trickle into some other muscular areas as well. Absolutely.
Yeah. So when somebody comes in to you with the diagnosis of IC, what can they expect for like the first visit? Because a lot of people don't quite understand pelvic floor physical
100%.
therapy.
Yes. No. Everyone's very nervous coming in. I promise I'm not that scary. So typically we get a really good history right off the bat. We get to know each other pretty well. Me more about them, obviously. And then we typically will do some sort of muscle exam. A lot of times it's internal, and that is not as scary as ones that you would have at the OB-GYN or the UROGYN, because there's no stirrups or speculums or catheters or ultrasounds or anything else like that, really. Because I'm just concerned about the muscles, their tone, your strength, your coordination. So assessing all of those